from Jovi sent the overall of what type 2 diabetes is?
Yes. Yeah, I've been really busy the last few days, so I'm kind of a little behind on Jovi's emails.
Totally. The big picture is this isn't a blood sugar disease. It's an insulin disease. So blood sugar is just a symptom. So it's sort of like saying that your runny nose is a cold. And it's not. It's just one of the many symptoms that a cold is. So your blood sugar levels is something that they try to keep you focused on that because the pharmaceutical industry is making so much money on it. It's I'm in the process of writing a book about reversing diabetes and just looking at statistics and everything. In 2017, diabetes brought in $247 billion for the year. So it's a huge moneymaker. And if people knew that they can get rid of the disease and how to do it, it would probably wipe out the healthcare system for a while. It'd be a huge crush to the system of all the money that's involved with this, because it's not just the medications that you're taking, it's the amputations that get involved with it. It's the heart attacks. 75% of type 2 diabetics that die, they die from heart attacks. So it's heart attack, heart procedures, strokes, amputations, neuropathy, liver disease, kidney disease. And the reason why all these diseases happen is because, and cancer too. So all these diseases happen because the sugar is not leaving your body. It's what they're doing is sugar is being stored in your fat cells. And when your fat cells in one fat cell, it can't push any more sugar into it. What happens is that a new fat cell grows so that more sugar can grow in there. So all these fat cells start going into your pancreas, which causes the type 2 diabetes. So if you get rid of the fat from the pancreas, you can get rid of the diabetes. The sugar goes into the heart, giving you heart attacks. It goes into the liver, giving you fatty liver disease. It goes into your kidneys, causing kidney disease. And so this is why type 2 diabetes has so many different diseases that are involved with it because of all the sugar. So we need to get the sugar out of you. And the only way we can do that is to stop putting it in you and letting your body use the sugar that it already has in you as energy. And the only way we can do that is to go against the status quo and stop eating the way that they're telling you to eat. You're not supposed to be eating all the carbs that you're eating. You're eating the carbs so you can keep on the medications. If you were taking those medications and you weren't eating the amount of carbs that they're telling you to eat, you go into a hypoglycemic state, and then you can go into a coma and you can die. So you're actually feeding your drugs so you can keep your drugs. So we need to get a vicious cycle that you're in, that the system put you in. And once we get rid of the sugar and decrease that, your blood sugar levels will start coming down, and you're in, I don't know, are you in? Yeah, you are in insulin. So
no, I'm just on metformin. I'm not insulin.
Oh, you're not on insulin. That's good because that's like the hardest thing to get rid of is the insulin. So
yeah, I'm just on the metformin.
Metformin, that'll be a lot easier. What are you taking, about 2,000 milligrams a day?
1,000.
1,000, so 500 morning and 500 at night.
Yep.
Okay, that's not too bad. It shouldn't take you very long. Can I ask you your height and your weight?
I'm 5'4", and proudly, since I've been doing this without meeting you, I've been doing it behind the scenes. I've already lost 7 pounds, so I'm down to 212.
212. Okay.
Yeah.
Okay. As I said, insulin is the problem. It's the blood sugar following. So what happens is you've been a diabetic for a long time. It's just what happens is your body releases insulin to keep your blood sugar levels down, and your pancreas has to work overtime. So if you keep working overtime, you're working 20 hours a day, every single day, eventually you get worn down, you get sick, or you just like die from exhaustion. Same thing with pancreas. So if it keeps working overtime over and over again because you keep putting all the sugar in you, it eventually stops working. So the pancreas went into overtime to keep your blood sugar levels down. And once your pancreas start getting worn out, then your blood sugars start going up. So the insulin has been up way higher for a much longer period of time than your blood sugar levels. were. Insulin always goes way before your blood sugar. So when the doctor sees the blood sugar level is going up, you already have a problem. And as part of the system that we have, they test for the wrong thing. They should be testing for the insulin and not for the blood sugar. I mean, they can collaborate the blood sugar with the insulin, but insulin goes up first. And there's in the overall view that we sent you, that Joby sent you, you'll see a study that they did in Europe called the White House study, and they proved that they can detect diabetes 14 years out before a person actually has it. But our medical system waits until you get it, and then they say, we got a drug for you. And then you get on drugs, and it's so hard to get them off.
Right.
Okay. So the only way you can get your insulin level down is to stop eating as often as you're eating. They're telling you to eat like every 4 hours, I think, every 3